Betty. Welcome back. It's great to see you again. I have some really good news for you. You've done the right thing by coming in and seeing us today. After careful review of your x-rays and the examination that we did the other day, I am confident that what you have is treatable with chiropractic. So the good news is you're in the right place at the right time. Now, since what you have is a chiropractic condition, I want to go over just a few things about chiropractic with you. First of all, you may remember from the video that we had you watch the other day, chiropractic is not new and chiropractic is not experimental. In fact, we've been treating conditions just like yours successfully with chiropractic for over 100 years now. And because it's been so successful and so popular, we're now the second largest healing profession in the Western world. Now, another interesting thing about chiropractic, WebMD just published on a report that was done tracking 2 million people over 4 years. And they found a 95% satisfaction rate with the chiropractic patients. 95%. In the medical world of healing, it would be impossible to find that kind of track record or success rate. So you can be confident that you're in the right place for the treatment of the condition that you have. And the third thing that I want you to know about chiropractic, and I feel this is the most important, is chiropractic is natural. And this is a big deal in the world we live in today. We've become far too dependent on drugs. And our body has been made with this amazing healing capacity that's far superior to anything that man could ever create, including drugs. So since the body's best, we should rely on it first. So have you ever wondered how the body knows how to heal itself? And let's take a cut on the finger, for instance. The body knows to stop the bleeding, put everything back together, and within a short amount of time, you don't even know that the cut was even there. The body does this through a system called the central nervous system, and it knows better than we do what it needs to be healthy. When there is no nerve interference, the body can better diagnose itself and heal itself through this system. So the first choice of healing should be natural before resorting to drugs with their potential side effects and also the risks of addiction. So drugs have their place, but it should be our last resort, not our first. So I want to, so let's move on and let's talk about why you're here. Let's talk about your pain and why you feel the way you do. So to start, your pain didn't start just yesterday your condition didn't start just yesterday, and it didn't start when your pain started. Pain is typically the last thing to show up in conditions like this. Your condition has been building up over a lot of time, and it's the accumulation of many events in your life. In fact, it may have started with the trauma of your own birth. And anyone who has witnessed childbirth can attest to the trauma and the stress that's put on the neck and the head and the spine. And then it doesn't just stop there. So think about all of the falls and accidents and injuries that we had as in our childhood and in our teenage years. You've needed this care all through growing up. It's it's amazing that any of us have lived past 5 years old with all the spills and falls that we have taken. Yet all these physical traumas as a child, they've been left untreated. The point is you've needed chiropractic since the day you were born, and it may have saved you from all the pain, wear and tear that you're going through now. And so certainly, if you know anybody, if you have any children, your children are having children, please keep this in mind, because they're going to more than likely live to be 100 years old, and we really want them to have mobility through all the years that they're alive. Now, let's talk about your lifestyle today. It would be impossible to know the number of improper lifting and trauma that you've had throughout your life. That's why I say it's not just one event. You have years of wear and tear already. And keep in mind, that's without any prevention, any treatment, nothing to offset the wear and tear at all. For example, think of going to the dentist. Imagine if you had not been to the dentist since you were born and not brushed your teeth since the day you were born. What kind of condition do you think that your teeth would be in today? Well, obviously, they probably would have fallen out by now. And through the years, you've experienced a lot of nerve and tissue damage in your spine, and you've left it virtually untreated. So you are very fortunate that you're not in more pain than you are today. So since these things have taken a lot of time, since this physical condition has taken a lot of time to build up, we need to remember that it's not going to be corrected in a day. It takes time. Another example, you gain weight over 10 years, and then you want to take it off in 10 days. It's not going to happen. Weight loss takes time. This is going to take time. And we'll talk more about that time component in just a minute. So first of all, let's talk about where you are right now. Let's talk about your pain and let's talk about the findings of the exam and what the result of all these years of wear and tear. So your spine has been pushed and pulled out of its normal alignment, and this has caused less flexibility, more irritation, more swelling, and also pinching of the nerves that flow out from in between each of the bones of the spine. The bones are called vertebrae, and the medical term for this condition is subluxation. And I want you to take a look at this chart right here, and this just gives you an idea of different things that can happen from subluxations in different areas of the spine. And I think you'll find it fascinating why so much of your health is impacted by this is because your nerves run from your brain and down out through the rest of your body and carry commands from the brain to your body and the organs that are there. This is how the body knows how to function and how to heal itself. So you came here today with some low back pain, and here's just a little glimpse of where the nerves go to from the low back and some of the problems that they can have. Growing pain, pain down the leg, abdominal problems. Sounds a lot like maybe what you have, right? Some of the issues that you have. So when the nerves are pinched, it's kind of like what we experience with cell phones. And when there's interference in the call, either the call is dropped or the call starts to break up. We immediately try to move and get that call interference out of there so we can get the whole message. The same thing is happening in your central nervous system. There's nerve interference that is blocking your body's communication, and the end result to that is pain and disease. So subluxations not only can cause more than just neck or low back pain, it can cause dis-ease in other parts of the body as well. And as we start to adjust and remove this nerve interference from your body, you may realize that you're feeling better in other parts. You're enjoying health in other parts of your body, not just in the place where you're having the pain in your back. Does that make sense? Good. So there's four stages of degeneration in the spine. And just like in other health conditions that you may know more about, let's talk about cancer, because a lot of people know a little bit about that. So the longer you let things go, the more severe the stage and the more severe the health condition becomes. So that's why it's so important to start treatment now and prevent further degeneration into the next stage. So today, I'll put you at a stage 2 in the spinal degeneration. And let me go over your x-rays with you so you can understand what I'm talking about. So since you can't take the x-rays home with you today, I'm just going to circle here the area that best exemplifies your current stage and condition. And this is for your reference, and then also if you want to take it home and show your husband. So I think we've discussed enough about why you're having your pain and what's happening. So let's move on to the next thing, and that's probably the most important thing to you, the solution. The solution for your healing process and wellness is going to be a series of adjustments. We're going to start adjusting your spine back into the proper alignment. And this is going to take time. And I want to talk to you about what's going on when I'm adjusting you. So while I'm adjusting you, you understand what's happening inside your body, because it's not something that you can see. So first, I'm removing the nerve interference so your body has 100% capacity to heal itself from its pain and illness. Number 2, I'm removing the nerve interference so your body has 100% capacity to prevent future pain and sickness. And thirdly, I'm removing the nerve interference for your future performance, so that your musculoskeletal system doesn't experience so much wear and tear, allowing you to have better mobility for your whole life. Now, you may have noticed that I said it's going to take a series of adjustments, and here's why I say that. So you don't just go into the orthodontist's office and they open up your mouth and all of a sudden in one visit realign your teeth and you're good to go. No, it doesn't work like that. They're going to tell you that it's going to take a series of visits, and they're going to keep adjusting your teeth, and over time the teeth will go back or will go into the alignment that they want. And that's the same thing that's going to happen here. See, your spine has been misaligned for so long that it feels like that misalignment is actually normal. So we're going to have to retrain your spine. And I'm going to adjust it, and frankly, it's going to adjust back to where it thinks it's supposed to be. Kind of like that 3 steps forward and 2 steps back. But we'll continue to adjust your spine until we have it retrained and stabilized in its proper alignment. But to get there, it's really important that you follow your prescribed visits for adjustments to a T. Don't miss any, so that we can retrain your spine and get your health back. Can you see why that's important? The number of treatments and the frequency of those treatments are essential to your spinal stabilization. So I've divided your treatment into 3 different stages. And the first stage is obvious, it's pain relief. We want to get you out of pain. Now, everybody responds a little bit differently to care. However, this week I'm going to see you every day, and then I'm going to see you 3 times a week for the next 2 weeks. Now, I'll be also applying some other therapies to help supplement the adjustments, and I'm confident that at the end of this phase, you're going to be feeling pretty good. In fact, you're going to be out of pain, and you're going to be thinking, problem solved. But that's just not the case. At this point, even though it's true you're not in pain, your condition is in a very fragile state. And with any wrong turn or any wrong move, really any wrong anything, it could set you back, right back to where you are today, or make you even worse. And then we'd have to start all over. That's why the second stage of care is actually more important than the first. And the second stage is your stabilization care. We want to stabilize your condition so you're not in that fragile state anymore. Now, before we move to the stabilization phase, we're going to do a small progress exam to make sure that you're ready for stabilization, and also to make sure that if you don't need as much care as we initially thought, we can pull back care a little bit. So, assuming you're ready, you'll graduate to that stabilization portion of your care, and I'm sure it's going to be easier on you, much easier on you. We'll see you 2 times a week. I still need to see you for the series of adjustments, but this time it will be 2 times a week for the next 3 weeks. And then of course we'll do another re-exam, or 2 times a week for the next 3 weeks. At the end of this phase, based upon a lot of people that I've treated with similar problems, I believe that you're going to be in a stabilized condition. And of course, we'll do a progress exam at this point to make sure that's so. So once you've graduated from once we consider your condition stabilized, you're going to move into the wellness care portion of your care plan. Now let me tell you why this phase of your care plan is so important to your health and wellness. The one problem I have with treating your case is that I'm never going to fully remove the cause of your problem. You're not stopping the cause of why you're here in the first place. You'll still be doing the exact same things that caused your subluxations in the first place. See, just like with your teeth, you go and get them cleaned, and wouldn't it be really nice if they just stayed that way? But they're not going to. You would never be able to eat again, right? And we know that's not going to happen. So you have to go get your teeth cleaned and maintained. So in the same way, you aren't going to stop your activities that cause the subluxations and the nerve interference in your spine in the first place, and we wouldn't expect you to. The difference is this time though, instead of allowing that wear and tear to wear you down to the point where you can't move, we're going to provide treatments which counteract your wear and tear. Prevention is always wiser than an overhaul. Wellness care is always better than sick care. And we'll make a recommendation for your wellness when we get to that point. So our overall goal here is your wellness, not just your pain removal. So our overall goal here is your wellness, not just pain relief. Natural wellness is what you need, and it's what I can provide. But in order to get you to that stage, there are a few things that I'm going to need from you. First of all, I'm going to need you to make all of those treatment times as we discussed. It's the number of treatments and the frequency that's going to make chiropractic work for you. And then secondly, I need you to attend a special class we have that is essential to your health and well-being, and happens to be a topic that I know you'll really enjoy and benefit from for the rest of your life. It's health information that I promise you've never been taught before. It's called How to Stay Young for the First 100 Years. Now, I have your tickets here with me, and I've included some for your family because if they could attend, I'm sure they'll really benefit from it as well. And we have 2 times next week that it's being taught, Wednesday in the evening and then Thursday in the morning. Which one of those can I expect you to attend? Okay, great. So I'll put that down in your chart. And before you leave today, Melissa will get your treatment time scheduled and will reserve a seat for you at the How to Stay Young class. And she'll also go over any financial questions that you might have. Now, now that we've gone over this, I'm going to sign your report, and this indicates that I have reviewed this with you and made the recommendations that I feel is best. And you'll need to sign as well, indicating that you understand and will make every effort to comply. Great, Betty. Now, unless you have any questions for me, I'm ready to get started with your treatments. Are you ready to get started?